male, right? I'm 57 years old. Now I have to pay $4,812 per year in terms of health insurance, just for me personally. That doesn't cover my family. That is a major expense. After my mortgage, that's the second largest expense that I have. And I remember whenever I went to see my doctor about this, he noticed that we don't cover that. So I ended up dropping my coverage. Luckily, the matters weren't too serious, but I have no particular faith in private health insurance. Get a job done.
Insurance has been going up and up for over the past 10 years. I found out in looking for other insurance, shopping for other insurance, that because of a pre-existing condition, I can't get another insurance. And I even went to the California Association that's supposed to help people who are uninsurable. And the cheapest insurance I get would be something like along the lines of $500 to up to $1,000 for this kind of insurance, and it would just be very basic insurance.
And I experienced a healthcare problem this morning when I went to my chiropractor. I got served today, but they say I won't make the next appointment because they're cutting all Medi-Cal benefits for chiropractor. They done cut my glasses. They're cutting June 30th the glasses, June 30th the denture, June 30th acupuncture, all the things that help us people, you know, the poor.
Basically, last year I was shot when I went to the hospital. I was treated pretty well until they found out that I didn't have health coverage, and then I was instantly wheeled into the poor people section, and the nurses wouldn't even barely talk to me. So they charged me $11,000, and they wanted me to pay that on my own. And then alone on the $11,000, they charged me two more bills, one for $1,000 something for the fire department, and another one for the doctors that examined me.
Back in the 1990s, I was self-employed. I liked it that way. I really enjoyed being kind of my own boss, having my own clients. And I was able to get health insurance at a group rate through a professional association. A few years in, I did have one series of medical bills. I had a little medical incident. We're not talking life-threatening, nothing serious, but it basically required a little monitoring for about 2 weeks, and there were some bills totaling around $400 that the insurance had to pay for. And I promptly got a letter in the mail that said, "We'll continue to cover you, but we will no longer accept your payments on a quarterly basis. From now on, we'd like you to pay on a monthly basis, and you're only assured of coverage for the month in which you have paid. We reserve the right to, at any time, refuse payment, thus canceling your coverage." So I called an 800 number, and I said, why? What is this? And they said, well, you've generated a red flag. And I said, there shouldn't be a red flag. This is not an ongoing condition. This will require no more treatment. This is not a big health harbinger here. And the woman on the phone was very frank with me, and she said, you really are only covered for 30 days at a time. And if you start generating more bills, then we will cancel your coverage or raise your rates, and there's no limit on that currently. I said, well, thank you for being so honest, but isn't this just like buying the illusion of health insurance? Like, what if I get hit by a munibus on the 30th of the month? Do you cancel me on the 1st? And she didn't hem or haw. She said, it is essentially our right to do that. I can't say whether it will happen, but it is our right to do that. And so very shortly after that conversation, I found a job where I could get in on the employer's health plan, and it is a little bit more secure. I would really rather be an independent contractor or an entrepreneur or start a business. But at this point, the only way you can really be assured of having coverage is to have a regular day job it's really the only way I can have insurance at this point, or have any assurance that there is insurance, if that makes any sense. I think I would rather be starting a business right now than being somebody else's employee. But I couldn't insure myself, and I probably couldn't insure my employees, so that's not going to happen right now.
Excuse me, can I ask you something? Sure. Do you have health insurance?
That was really nice.